Hello again, it's Mr. Fox coming to you from DigiFox Labs. Today we're going to be talking about a specific sector that is very familiar with every single individual in the world. Now, the project we are actually talking about is involved in the healthcare. That's right, we are having a blockchain meets healthcare protocol involved right here, right in front of your eyes. Now, none of this financial advice. We are not financial advisors. Everything said here is 100% our opinion. Now, honestly, for those of you that are very much kind of, I guess, in between as far as investing in something that's sound and 100% a transition from the old system to the new system, for example, insurance, right? You can invest in insurances. You can go ahead and do so not only on the blockchain, but as well as in the real world, right? Well, now we see here there is a protocol that is literally in the healthcare, and this can actually provide a bridge for much wealthy individuals to go ahead and take a position in not only the blockchain space but as well as healthcare. So you have like Johnson & Johnson and other major healthcare or big pharma industries that is going to go ahead and partake in this blockchain space. So we can see here that we have right here on solve.care, it is going to be the Solve protocol. So it is a blockchain platform for digital healthcare networks. Quite bullish if you ask me, just with the headline right here on the webpage. Relationship management meet blockchain meet healthcare. So we could go ahead and scroll further down onto the page and we can see pretty much what they're going on about. So as you see here, it's a full stack platform, the full stack blockchain enabled healthcare platform that decentralizes health networks. So we can see here they are focusing on partially on application management, business logic management, data, predictable performance, cost effectiveness, identity, and access management, all available on individuals' personal phones. So we can see here you have care.wallet, which is the gateway to a diverse range of care networks where you have total control over what network services you want to use. Some of those are going to be diabetes care, mental health, transportation, employee wellness, provider payments, as well as global telecommunications. Teleconsultations. Apologies for that. And so if you look right here, this is pretty much going to be major sectors in the healthcare. Diabetes in the Western world is a very big problem, diabetes is, and it is a multi-hundred-billion-dollar business. Mental health care, it is going up in a trajectory pretty much like a hockey stick because number one, there is new information, new data, better advances in mental health patient care. So with that said, there is still more to come in the mental health sector. So that is another area where individuals, especially with the what is called the C19 issue that happened last year, 2 years ago, right? I can't really say that because of YouTube algorithm may not like us using that specific word, but it really did focus and make individuals realize that they may have this issue right here: mental health, transportation, employee wellness, and provider payments, all of which is very much going to help with the bridging and the infrastructure in healthcare. So scrolling further down, what else do they do? Well, they design and build your own care network with care.labs. It gives physicians the power to change the world of healthcare. It's more efficient practices, patient-focused practices, and cost-effective practices. And if you're interested in doing so, you can go ahead and get started with clicking this link right here. So we can scroll further down, and what else do they say about solve.care? They are redefining the way healthcare is accessed, delivered, managed, and paid for. That is essentially everything that healthcare is included in. Now, there are different methods and as well as different forms of healthcare even within the Western world. Obviously, if you compare a developed nation to a developing nation, there is a bit of a difference as far as access to care as well as the cost of care, and all that is going to be helped with in right here, potentially bridging the gap on a global sector, right? So you can see right here, for example, it improves access to care, as we just indicated earlier, administer healthcare more efficiently, pay providers for results accurately and on time, improve outcomes, and reduce overall cost. So essentially what this could potentially do, and this is our opinion here at DIGIFOX Labs, it's removing middlemen or women that pretty much you have to have referral after referral, as well as needing different members involved just to get from point A to point B. Point A being you have a problem, so you go to point A and you go to the hospital, and then you have like your point B sector, but in order to get to point B, you need to see A.1, A.2, A.3, and deal with all these middlemen and all women to get to where you need to go, which is point B. And so this improves the outcomes and reduces the overall cost because you have to pay for those middlemen and women for you to get, which is the end result, for you to get better, whether it be physical or mental or anything in between. Pay providers for results accurately and on time. Again, it is direct payments potentially to doctors. Again, our opinion on how this potentially could work. Improve access to care. Well, considering it's on the blockchain, it's going to be through the internet and potentially 100% speed line. You may not even need to go to a hospital, right? So that is our theory on how this is going to work, right? So we can go ahead and scroll down. Clients that they serve are, ironically, look at this: insurance companies, clinical organizations, accountable care organizations, benefit administrators, government agencies, that is key, employers. Right, so if you look at all this, this is all of your middlemen and women that you have to really go through in some form or fashion, and all of which, most of which, is going to be behind closed doors. You're not going to really have it because you're going to have a front end dealing with all of this, right? And so this is essentially putting all these on the back end of the back end, and maybe even going to make more of, let's just call it a treaty to make things a little bit more easier. So that is definitely something that's bullish, as they have clients lined up with government agencies. And if you have government agencies lined up, you're going to have essentially an easier time getting to insurance companies and benefit administrators, because benefit administrators usually go hand in hand with government agencies, right? Accountable care organizations also can be positioned closely, if not parallel, to benefit administrators as well as government agencies. And then clinical organizations also go hand in hand with insurance companies, which then go hand in hand with benefits administrators. So you can see that they are all linked in one form or fashion. So that is 100% bullish in this project. Decentralizing healthcare. Now, that's a key word as far as decentralizing healthcare, right? Decentralization is very much key and is very much in the current trend with the way things are going in the world, right? So we can see here the platform decentralizes healthcare by tokenizing 5 key aspects. So the way they're going to do that is decentralize these things, which is identity, which is the healthcare identity systems are fragmented, hard to secure, and exclusive tokenization of identity, on the other hand, provides anonymity options. It is the ideal solution for protected healthcare because tokenization significantly reduces risk. So identity. That is going to be interesting, actually, how that's going to happen. As far as keeping it, I guess, a little bit discreet. Now, usually healthcare is very much on top of keeping your personal health records on the hush-hush unless absolutely necessary. So that's going to be interesting how they go ahead and bridge that across to the blockchain and make that, I guess, a bit of keeping a client's anonymity. So we can see here the next thing they want to talk about is decentralization of data. On solve.care platform, the healthcare organizations can give ownership of data back to users. The blockchain will reinvent the way electronic health records are shared and stored. That is very much interesting. Again, that will be very interesting to see how that comes to fruition. Consent is another way. So you have HIPAA and GDPR, as well as high trust compliant digital healthcare networks. Transactions, which blockchain is 100% transactional based, hence the ledger, hence the infrastructure of blockchain technology, right? And payments, which obviously transactions and payments go hand in hand. So that is very, very interesting, and 100% things that we need to actually just wait and see how they materialize. But the whole concept is 100% bullish and 100% very much something that has never really been seen before in the blockchain space. So let's go ahead and scroll further down onto their website. We can see here components of the platform. So they have your care.wallet, which is going to be located right here, I'm assuming, in the top right hand side of the web page. Care cards, let's see, they are purpose-built applications inside the Care wallet that fit individuals or provider specific needs. So I'm assuming they're going to be like credentials of some sort, or even like certain things that an individual has on the medical record, I'm assuming. So it'll be like essentially a medical record if you're a patient, as well as certs, education, qualifications for the healthcare provider will be in their My Wallet. We can see here, again, that's just our opinion here on DigiFox Labs. And we can see here, Solve, a unique digital currency for healthcare usable for transactions on the Solve platform. So in order to use this, you need Solve, which we're going to talk about later on. Solve is the token that they're using. Care protocol, an immutable decentralized application protocol that governs a care network. Care Vault, storage for data. That's very good. Care ledger, events are recorded on a ledger, so which that is going to be 100% blockchain based and very much self-explanatory, really. And we can see here, scrolling down, what their clients are saying about them. Now, I'm not really going to play this, but we can see here Dr. Kevin Honikin, CEO of Arizona Care Network, that's America. He's behind this a little bit, or at least has some sort of involvement with solve.care. Let's go and scroll down a little bit more. Some of the network on a platform. We have these individuals here: Global Telehealth Exchange, Provider Reward Network, non-emergency medical transportation, Diabetes Care Network, and Team.care Network. So I'm not really familiar with all of them, but definitely if you want to read more, you could go ahead and do so. We'll provide a link in the description below to go ahead and do so. And then we can scroll down, and they have actually won awards as well as nominations, which is always good. And we could also see the Enterprise Blockchain Awards 2020. So very recently, they received an award, and they received another award from the SSOW yet again in 2020, as well as the World Blockchain Award for Innovation Blockchain Solutions. So they are definitely on the radar for the past 2 years by winning all these awards. And you may think that, oh, what's the big deal of winning an award? Well, it's getting headlines. It's getting exposure to what you are exactly doing and what you're trying to solve, which is ironic because that is the name of the token. So we tell the healthcare story in a different way, is rewriting how healthcare is explained. Request a storybook that shows you how. We very well may get the storybook. Let's just not forget, shall we? So the press releases. We can see here that they have been in the news quite recently in South Korea with the Metaverse Doctor Alliance, which we'll get into that. That is 100% bullish. Physicians, the power to change the world of healthcare, telehealth, and addressing rising cost in Medicaid. So this is America right here. So the American Research and Policy Institute joins forces to address rising costs in Medicaid. So that is a very bullish article. Very, very bullish. So we'll definitely have to address that later on. And we can scroll down, and they've been in these specific articles. Let's scroll further down on the webpage. You could download a working app on the iPhone as well as Android phones. And that's pretty much it on the bottom of the webpage. Now, what exactly are they doing? So they are empowering members for insurance companies. Keep that in mind. They are empowering members for insurance companies. Now, in America, it is a bit of a privatized healthcare system there. And so that is very much going to open the doors for massive amount of liquidity coming into not only this project, but just healthcare in general into the blockchain space. Now, reverting back to what we just stated, it is going to provide liquidity to solve.care because there's not much competition in the healthcare sector, is there? So keep that in mind. Okay, now we're also going to go to the the accountable care organizations, right? And this is exactly what they do. They give patients incentive to stay inside your network, engage patients in controlling their own healthcare, reward providers for performance and outcome instead of services. So that is interesting. So if a patient comes in and they have issues and they are rectified, the provider gets some sort of performance. So you are not only going to get clients wanting to partake in this and support this network, you are going to get the actual employees to want to do the same thing and actually provide better healthcare by giving them incentive. That is brilliant, actually, really. That is a damn good business model if you ask us. Let's go ahead and scroll further down and see what else they got here. How care wallets can work for patients in ACO networks. Let's see, create your own care administration network. So I'm assuming they can actually cater to physicians that open up their own clinic, if I'm not mistaken. That could be interesting to actually see. And they have requests here for you to go ahead and do so with your company employee size. And I'm assuming that's exactly what it is, right? Employee size 1 to 50. So if you have your own clinic, you can actually do that as well. That is very interesting. And we see here that they have careers if you're interested in working with them. And now we go to the news. How solve.care and the Metaverse Doctor Alliance are ushering in a digital healthcare revolution. We can see here on the news, the conference, wrangled by top neurosurgeon Dr. Lee Eon, decided that it was time for a change to the lack of leadership that characterizes medical innovations. And so came about new council, the Metaverse Doctors Association, to tackle the next revolution in medicine, the metaverse. So healthcare is going into the metaverse. That is very interesting, considering everything that's happened in the metaverse space, especially with Facebook essentially giving a kick in the bum to the investors that have taken a position in the metaverse. That is very interesting. So we can see here that solve.care was actually invited among the young doctors with big ideas and old doctors with, among the young doctors with big ideas, the old doctors with young minds and fresh-faced medical students stood a single, that's right, a single blockchain company, of which who was invited to participate in the Genesis event. It was solve.care. Again, we stated that they potentially are the only ones involved in the healthcare sector of blockchain technology, and they were the only ones that were essentially invited to the Genesis event, an event that is actually creating a Metaverse Doctors Alliance. How can you not be bullish? How can you not want to take a position? I believe any position right now in this coming days, weeks, or even months is going to be very fruitful for individuals that did so, right? Again, not financial advice. So this is coming to you from coinrivet.com. Okay, and as we see here is a screenshot of everything that you could potentially be seeing. And so the metaverse can assist in addressing the demand and supply issue currently facing practitioners and patients. We want to create options, an efficient meeting place, and in turn remove the stages in which the process of consultation and diagnoses gets slowed down. So they are trying to streamline everything. And so imagine like having a metaverse and not having it go really like anywhere. You just go to the metaverse, you discuss your issues. So imagine how this can actually help, right? Mental health issues. This is what this can help. Yes, if you have a broken leg, I don't believe this is going to be something you need to plug into the metaverse and get diagnosis and get treatment for. What are they going to do? Mail you your cast and you do it yourself? No. But if you have mental health issues, this I could see definitely helping those individuals with mental health issues. This I could see helping individuals that are seeing a nutritionist, a dietitian to help their diabetes. So there you go. Again, we're not healthcare professionals over here at DigiFox Labs, nor are we financial advisors. So keep that in mind when we talk. We're going to go ahead and put this in the description below so that you can read this article in its entirety. But let's get to the price of the token. Solve is currently trading at 11 cents with a circulating supply of 440 million with a total supply of 1 billion tokens. Market cap of 48 million. 24-hour trading volume is only 1 million. It is on the Ethereum blockchain. And we can see here that it's very, very much a micro cap. I mean, think about this for a minute, all right? They essentially have potentially a monopoly. I mean, they are probably the furthest along in the healthcare sector, specifically the healthcare sector. And you're telling me with a global reach for what they're trying to do, they're only 48 million? You've got to be kidding. Like, no. Maybe if we get in the billions, sure. So let's just take it to a billion market cap, which in the healthcare sector, that's small. So we are looking at a potential 10 to 20x right here. Right here. So we can see here that they actually launched and have been in production since the last bull run. And it was, I mean, let's be honest, like, what, $2, $3? Look at this. It's 11 cents right now. It was $4 at the all-time high 4 years ago, and it's down 97%. Why would you not want to take a position? Why would you not want to take a position? That's massive gains. Literally. This is the stuff that you hear about on the YouTubes about individuals investing like $1,000 and ending up coming back with 6 figures or even $1 million. Now, let's go look at the team. That's something we didn't do, okay? Let's go ahead and look at the team. And we're going to show you why you should be investing. Leadership. Now, they all have information, okay? Now, we have certain individuals here. So let's go ahead and look at the CEO. And you have here, this individual's been essentially with innovation technology companies as CEO, COO, as well as CTOs for 30 years, okay? And been a part of Medicaid, children health, insurance programs, SNAP, which is welfare. Oh, and look, child welfare program. So he's got experience in everything that would be associated with solve.care. So he's definitely on a CEO that you need to look at. And then you have the chief financial officer. Let's see what this individual has, right? Let's see here. CEO and CFO positions in companies listed on London Stock Exchange as well as the NASDAQ. Okay. Let's see what else he's got going on, right? He oversees financing and planning and reporting legal for solve.care. So again, 20 years with companies on the NASDAQ and London Stock Exchange. I mean, come on. That's massive. All right. The marketing and communications director. Let's see what this individual brings. Let's see here. Experiences in corporate communication, brand management, partner management, public relations. So she's very much a PR expert. Let's see here. She was part of the AXA group of Ukraine. They have, I believe they are actually headquartered out in Ukraine, if I'm not mistaken, but they have offices throughout the world. Let's see who the next one is. Now, we're going to go actually straight to the advisory board, okay? And we need to show you this. Congressman, U.S. Congressman, former, right? Let's see, Virginia 2015. Okay, so they have the U.S. government involved in some form of fashion because let's be honest, right? Do you really think he's not going to have connections in the government? Yeah, I think he is. So that's key to note. Let alone the CEO has been working in U.S. government agencies affiliated with healthcare. All right, so let's go back. Let's go to Dr. David Randall, PhD. Let's see here. Receives his PhD in political science from Kent State. Let's see what he's actually got. He serves as executive director and is resident scholar with the American Research and Policy Institute, the ARAPI.org. In DC, extensive experience as a former top insurance regulator. Listen to that. Former top insurance regulator. Healthcare lobbyist. Meaning all the healthcare insurances in America and potentially around the world he has experience and connections with. Let's see the other advisor. Let's see what he has. Okay, Mike Kissel is the president and CEO of Cleveland Clinic Canada and is responsible for the growth of Canadian facility, strategic partnerships, and enterprise value creation. So now they've got connections with Canada, I'm assuming, right? What else they got? Leading medical centers throughout the United States. These are advisors, ladies and gentlemen. These are advisors. Oh, here we go. We have another one. Look right here. Over the last 44 years, he has had a wide variety of career experiences with Aflac, an insurance company, a massive one in the Americas. Massive. Aflac announced his retirement to make way for the next generation and for his pursuit of other endeavors, including his role as an advisor to the solve.care Foundation. So there you go. A health insurance regulator, a health insurance top board member, a congressman, a research and policy institute member, director, and neurologist at Cleveland Clinic Canada, which we just talked about with Mr. Cassell, I believe. Let's see here. Actually, let's just check on him, right? Chawala. Excuse if we messed up your name. Let's see. Dr. Chawala is urologist at Cleveland Canada Clinic. Urologist, American Board of Urology, and fellow of Royal College of Physicians and Surgeons of Canada. So obviously Canada is involved. So we got the US and Canada. What else do we got right here? Dr. Un Lee is one of South Korea's leading neurosurgeons. South Korea is involved. There you go. IBM Watson for oncology services. So is there some sort of IBM partnership as well? I mean, we can only speculate. That's all we're doing here. And I don't understand why anyone would not want to take a position. At 11 cents, ladies and gents. 11 cents. Last bull cycle, it was at what? $4 it stated? $4. Take a position, a small position. Why would you not? I mean, $4. And it's currently going for what? 11 cents. Do you realize a 10x is going to be $1.10 from these prices? A 10x. This, ladies and gents, at $4, this is a $10 coin. Come off it. This is 100x. Easy. Which puts it around $10, $11. There's a billion tokens of this. This is something you buy. You put it off in the ledger, right? Because it's an Ethereum token. It's an ERC20. You put it in your ledger. You put it in your MetaMask. And you forget about it. This is something you invest money in that you're okay with if you just throw it away. But at the same time, minimum once a month, check back. Check back on it. Check back on not only the project, but your wallet. DigiFox Labs rests its case. Ladies and gents, you need to invest in this. Again, not financial advice. I know that's a bit of an oxymoron, but it is what it is. We went ahead, full disclosure, took a position roughly around the 10-cent region. So roughly around the prices right here. You can get this coin a couple of ways. It's not even on major markets, actually. It's on Uniswap. It's on Oh, gosh. Actually, that's interesting. That's very interesting. So they actually added Bittrex. We literally looked at this not too long ago, and Bittrex was not on here. It was literally KuCoin, Uniswap, and CoinTiger, and HitBTC, if I'm not mistaken. So it's available on KuCoin, which if you do not have a KuCoin and you're in the Americas or somewhere where KuCoin is not authorized, you may need to get a VPN. We do have a link in the description below for a KuCoin code. Go ahead and use that code. save yourself some monies. And Bittrex. Now this is going to be Bittrex Global, if I'm not mistaken. And then Uniswap if you want to be decentralized about it. But again, with the Ethereum gas fees, I don't know if that's very wise. So with that said, happy days, happy trading, and good luck to you all.